Welcome back. According to recent data from the New York City Department of Health, the 10455 zip code in the Bronx, where Lincoln Hospital is located, has the highest 7-day percent positive rate for the deadly virus at 7.61%. Nurses and doctors are now preparing for a possible second wave of surging cases in the area. Joining us now to share more about their personal experience as a nurse during COVID-19 in the Bronx is nurse Narelia Oliveras-Arzuaga. Narelia, thank you again for coming on. You came on a couple of months ago. How are you? How have things been going since then?
Um, well, I think we're learning to be adaptable in this situation because things have changed and things are continuing to change. So I think that for the most part, I've just been, taking it day by day and, just trying to be as informed as possible, and trying to share whatever information I have so that I can be of service, to the community at a higher level than just one-on-one with my patients.
Right. And how have you been dealing with the sudden rise in cases that are coming through? How have healthcare workers and you as a nurse been dealing with that?
That's a great question. I think that everyone is, coping as best they can, I have to say. I think that we haven't really seen such an increase where we are feeling the way we were feeling before back in March, April, and May. But I think there's like small little whispers, we're talking around the hospital, like, do we have enough supplies? What's going to happen really after this Thanksgiving holiday? I think is the question on everyone's mind right now. As nurses, we're really paying attention to what's happening, watching the news. So we heard something like 6 million people traveled over this holiday break. And I think that as much as we understand the need emotionally to be there with your loved ones, we also understand that we've had 4 million newly infected people this past November alone. So we understand the situation is dire right now. And a lot of us are continuing to make sacrifices, like not seeing our own family members, because we know that we have to be, we have to be an example, and we also have to keep our own loved ones safe. We would be really irresponsible of us not to do that. So it's a lot, and it's a lot, but we're just aware, keeping track of what's happening, and, slowly mentally starting to prepare for what could be, this peak in the second wave.
Absolutely. And I think that's something I actually wanted to mention. So I'm glad that you mentioned the Thanksgiving holiday and how many people traveled. You said 4 million cases started surging in November.
Yes, we've had an increase of 4 million cases nationwide in this month alone. We're at 11 something, almost 12 million, if we haven't reached the 12 million person infected mark in the United States, and 4 million. So a third of those cases have just happened within the last month. We can think about it that way.
And how can we avoid this from repeating itself when Christmas comes along? A lot of families like to get together, especially, Hispanic. I know my family loves to get together, but it's not the same this year. Personally, my family didn't do anything this year for Thanksgiving, but everybody stood in their little, pods in their little circles. So what would you say to families who are thinking and considering going to get together for Christmas season?
I would say that I understand the desire to want to be there. And in some cases, people need to take calculated risk. If it's the last Thanksgiving that you may have, with a loved one, you may choose to say, I'm going to take this chance. But, we've been looking now, thankfully, the CDC has been able to provide more guidelines now with this change in the administration that is, happening now. And so we have a resurgence of the CDC as our leader, as our public health expert, and we should definitely adhere to CDC guidelines. And the CDC guidelines are saying that you should not celebrate with people that are not in your immediate household. Um, and as difficult as that is, I think we need to stick by that, because if we don't, our family members we may not be there to celebrate, or our family members may not be there to celebrate next Christmas with us. So do you sacrifice the end of a terrible year and look for towards the future, or do you say, I'm going to take this chance, and then who knows what's going to happen, January, February. We want this to end.
Yes.
We're all looking forward to this ending. So we have to do our part, as difficult as that may be.
Yes, it is difficult, but it's definitely necessary. And thank you for sharing, more on that. Narelia, what would you say has been the toughest part of your job as a nurse throughout this pandemic?
Um, I think I go back to what I said before, where, not being able to help people, get better is something that I think all of us in the medical community struggle with, because we are taught to heal, to help. And I think this feeling of, where you feel kind of like futile, like there's nothing more that you can do. I think when it reaches that level, when patients are severely ill and in the ICU, I think that's probably the biggest strain on nurses and doctors, because you're doing so much. You're consistently working, consistently giving medication, giving treatments, doing a whole bunch of things. And to know in the end that it's not going to be the outcome that you want it to be, is really difficult and frustrating. And, in the nursing community, there's talk of people not returning to nursing in the following years. And nursing has been such a booming, profession, and such a, just, it's noted, it's well respected. It's, people think of nurses as like, heroes, but the truth is that you're a person, you're a regular person, and you consider it just doing your job. And seeing people consistently be really ill and away from their family members and die that way is something that it's indescribable, and it just goes against everything that we know and we feel inside. So I think all of us have a little bit of like PTSD from all of this in a way. It's difficult.
Yeah. I can imagine, and I can just say thank you to you and so many other essential workers who have put their lives on the line throughout all this, this entire pandemic. It's been months now, and here we are still, combating this virus and trying to just, like you said, provide information. As a healthcare worker, you're here joining us outside of work hours to help people understand, like this is a serious thing and we should all be taking care of each other. So thank you for the work that you've been doing, and don't feel bad, like even if you are a healthcare worker and sometimes it feels like you're being defeated because of the work and how people are passing away, you're doing your best. So thank you, and thank you to your colleagues as well.
Absolutely. Thank you for saying that. I was just thinking that, we have to look out for each other, and do our own like self-care type of things. I actually did travel. I was actually away in Chicago for 5 days.
Oh, wow.
I know that was a little bit risky. I of course made sure to always have my mask on and always be really well protected. And I avoided crowds and things like that. It wasn't like there was a lot of those type of activities that were going on. But we do need to take care of ourselves, and it was a really restorative trip. And I kind of want to see what it was like to fly during the pandemic and just see like, okay, I flew during the pandemic, but I was also kind of scared. I actually came back and I had a little cough and I was like, oh my gosh, I instantly regretted it. I was like, no, what did I do? But no, it was a great trip. It was amazing. And the point is that we as healthcare workers need, we need to take care of ourselves as well and recognize that when we need someone to take care of us,
Yes.
because that may happen as well.
Yes.
And that's real. It's hard to ask. We don't normally ask for help. We nurses, we're the worst patients. We're never sick, according to us. But yeah, we also need to do what we have to do for ourselves so that we can continue to care for patients and give them the highest level of care. Because when we are spent, mentally and physically, it's really difficult to do that.
Very true. Like you said, you're people too, so you need, self-care as well. We've heard, Narelia, from the CDC and the city that everyone should get tested, and getting tested more than once is actually something that's been being pushed as well. Can you share why this is important right now?
Absolutely. So being that we're so far into the, this pandemic, we've had time to develop different types of tests. And so there's different types of tests that are appropriate for different situations. So everyone get tested, yes, but also know the level of risk that you have. So there's a rapid test, which just detects like if there is a copy of the virus. It's usually done via like a nasal swab. Some people say the COVID test, it hurts or it's uncomfortable. Yes, there's one that they do in the front of the nose. That one doesn't hurt at all, and that's usually that's a rapid test. It's a basic screening is what it is. And the nice thing about it is that results come back quickly. Sometimes, as some people I've heard say, my research said it's close to 15 minutes. I personally haven't seen that at the hospital. The fastest one I've seen takes about an hour. But the flip side of that, of course, is that these tests are not as accurate, and some people have gotten false negatives. So that false negative may embolden someone to say, hey, I don't need a mask, or I can be around other people, and they unknowingly may be spreading the virus. So my research recently was showing me that small gatherings are actually the largest spreader of COVID-19 right now in New York. Obviously, we can't do big gatherings, but there's like a false sense of security. Like, okay, if I have less than 10 people in my house, I'm okay. And the truth is that the way things are going now with 4 million cases last month, that's not necessarily true. So the false positive may give people that sense of security. And so that's not always an appropriate test. For us, big healthcare workers, we do a test it's called a PCR test. And basically that test is also done by a swab, but it goes a little bit higher into the nasal cavity. And that test usually takes about 5 to 7 days to result, but it's a much better indicator of actual disease. So those are the two main tests right now: rapid antigen testing and PCR testing. Again, depending on your level of risk, you should speak it with your healthcare provider, and they should ask you questions about your level of risk and then determine which type of test is most appropriate for you.
Thanks for clearing that up for us, because I know a lot of people may be taking the wrong test, like you said, and getting the false positive or the false negative. And
Right.
you want to ensure that they are taking the correct test depending on their contact, I guess, right?
Of course, of course. I mean, if you're someone who really has been working from home, really has not gone out, has always had on their mask, and has not been near anyone that is sick, a rapid test may be perfectly fine for you. If you are a healthcare worker, if you have been around people that have confirmed disease, those are different situations, and you may want to do the PCR test for that. I've only had the PCR test done. I actually would say that I wouldn't trust a rapid result, not for myself that has such a high level of risk at least. It's better to wait for results and quarantine while you wait, but just make sure that result is the most accurate one. And there's no reason why you can't retest. I've been tested 4 times, and I definitely was tested after travel, immediately after travel. And then I repeated my test 3 days later, which was the latest recommendation from our governor, Andrew Cuomo. So if you travel, make sure that you get a test as soon as you come back, and then take another test 3 to 4 days later, so you can have confirmatory testing. There's nothing wrong with retesting. It's probably the safest bet to make sure that you have accurate results nowadays.
Got it. Thank you, Narelia. And before we go, how can people get tested at Lincoln? How quick is it? And what do they need? And is it free to get tested?
Those are awesome questions. So I know that people can get tested at Lincoln. This is actually something new that Health and Hospitals Corporation has been implementing at the hospital. So it's testing that's available to the public. I actually, because I'm on the unit, I haven't really gotten a lot of information about the program, but I know that there's plenty of people that are at Lincoln right at the front, and they're able to guide you. Everyone who comes into the hospital must wear a mask, must have their temperature checked, and just state that you're coming to Lincoln to get a COVID test, and they will direct you. There's lines, so that is very organized from what I've seen, and it's done in the lobby. So it's a pretty spacious area. there's lines, so that you have to wait, you register, and then you wait, and then I believe someone takes you to a room in the back. There may be one other person getting tested, but they'll be 6 feet from you. And then I'm not sure how long those results take. You would need to speak to whoever's doing your test to find out.
Thank you again, Nurse Narelia, for joining us today.
Not a problem, Sonyi. Take care. It's a pleasure to be with you
As
guys.
well, pleasure to be with you as well. Take care, and thank you so much for your work and for the work of the nurses that you work with throughout this pandemic.
Always. It's a pleasure to serve. Take care.
NYC Health and Hospitals Lincoln, located at 234 East 149th Street, offers COVID testing and antibody testing Monday through Friday, 9 a.m. to 6 p.m., and Saturday through Sunday, 9 a.m. to 4 p.m. You can call 718-579-5000 for more information. And for more free testing locations near you, you can text COVID tests to 85548. Continue to wear a face mask, keep 6 feet apart, and be safe. We'll be right back.